Do you sometimes notice a red, painful bump on your skin that feels warm and swollen, maybe even oozing pus? Or have you or someone you know had a small cut turn into a big infection that just won't go away? That might not just be a simple pimple or bug bite. It could be something more serious, like MRSA. MRSA stands for Methicillin-resistant Staphylococcus aureus. It's a type of bacteria that's tough to treat because it doesn't respond to many common antibiotics. Imagine your body's like a fortress, and bacteria are invaders. Most antibiotics are like trained guards that stop them. But MRSA, it's like a super intruder that laughs at the guards. It's especially scary because it spreads easily in places like gyms, hospitals, or schools. So let's learn more about it together, because knowing is your best defense. So what causes MRSA? Let's break it down. You know, Staphylococcus aureus, or staph for short, is a common bacteria. It lives on the skin or in the nose of about 1 in 3 people, often without causing harm. Like a quiet neighbor who doesn't bother anyone. But if there's a cut or scrape, boom, the bacteria sneaks in and causes infection. Now, MRSA is a special kind of staph that has changed over time. Why? Because of how we use antibiotics. Think of it like this. Every time we take antibiotics when we don't need to, like for a cold, which is caused by viruses, we're letting the weaker bacteria die, but the strong ones survive. Over time, the strong ones, like MRSA, become superstars at resisting medicine. That's why MRSA is called resistant. It's evolved. Hospitals used to be the main place for MRSA, but now it spreads in gyms, locker rooms, or even schools through shared towels, razors, or sports gear. Now, how can you tell if it's just a pimple or something more like MRSA? Let's play a quick game. Imagine you find a bump on your arm. Is it red, warm, and tender like a bad zit? Yes, maybe just a pimple. But what if it's getting bigger, feels like a water balloon under the skin, or starts leaking yellow goo? And you feel feverish or tired? Ding, that could be MRSA. Common signs include swollen, painful rashes that look like spider bites, boils, or even deep abscesses. In bad cases, it can get into the bloodstream, lungs, or bones, leading to serious illness. Think of it like a tiny fire that spreads if not put out early. Athletes sharing equipment, kids in daycares, or even someone after surgery, all can be at risk. So always ask, has this skin issue worsened quickly, or hasn't improved with basic care? If yes, see a doctor. How do doctors figure out it's MRSA? Simple, they play detective. If you have a bad-looking skin infection, they might take a swab, poking it gently to collect some pus or fluid, and send it to a lab. The lab grows the bacteria and tests which antibiotics will work, like a taste test to find which medicine the bug hates. This is key, because treating it with the wrong antibiotic is like using water on a grease fire, useless, and can make it worse. If it's MRSA, doctors choose stronger antibiotics like trimethoprim sulfa, doxycycline, or clindamycin, taken as pills or even IV medicine in hospitals. Sometimes they even need to drain the pus with a small cut, no stitches, just letting the bad stuff out. The key, don't pop it yourself at home. That can spread the infection. And always finish your medicine, even if you feel better, like clearing all enemies on a mission. Can you stop MRSA before it starts? Yes, and it's easier than you think. Think of it as personal infection control. First rule, wash your hands often with soap and water, especially before eating or after gym. It's like wiping the bad guys off your hands. Second, don't share personal stuff like towels, razors, or deodorants. Imagine sharing a toothbrush, yuck, right? Same with these items. Third, keep cuts clean and covered. Use a bandage until healed. Fourth, if you use gym equipment, wipe it down before and after, like giving it a quick shower. Hospitals use special gowns and gloves for MRSA patients. You can use common sense at home. Also, never pressure your doctor for antibiotics when you have a cold or flu. You'll protect yourself and others. Prevention is like building a shield: small habits, big protection. Cool news: scientists aren't giving up on MRSA. Right now, researchers are working on new treatments. For example, some are testing phage therapy, using special viruses that hunt and kill only MRSA bacteria, like a smart missile. Others are creating new antibiotics that can break through MRSA's defenses. There's also progress in fast testing. Imagine a paper strip that tells you in minutes if it's MRSA, like a pregnancy test but for infections. Some hospitals now screen high-risk patients with nose swabs to catch MRSA early. Plus, researchers are studying how probiotics, good bacteria, might help keep MRSA away by crowding it out, like friendly neighbors not letting bullies move in. These advances bring hope. One day, MRSA might not be so scary anymore.